Welcome to the ExtendSys EpicCare Link tutorial. This is the home screen of EpicCare Link when you initially log in. Please note that you can use Happy Together Link to combine your new login with other Epic Link sites you might use, like Guthrie and Upstate, to make life a little easier. In Unread Messages, you will see any unread in Basket messages. This saves a click to the In Basket activity at the top. Next is the Quick Links section, which contains some guides on how to perform many of the functions of EpicCare Link. These include placing orders, referrals, and information for site administrators. Let's choose the In Basket activity. In Basket is the primary communication tool in Epic. Messages will arrive in predetermined folders, like lab results, imaging, and referral notices. You can respond to messages just like you would an email, or start a new message by clicking on New Message. You can always refresh to check for new messages, or use Search to comb through all your messages. With Out of Contact, you can notify anyone messaging you on Link that you are not available for an extended period of time. Please note that patient messaging is not currently available through Link. Let's try out the Operating Room Marketplace. Here you can schedule or cancel upcoming surgeries, check availability, or cancel block time. Simply select your provider, times, and location and search to see available scheduling blocks. Once you select your block time, you can use the Request Time button to start a message to the operating room team, who will review the information you have entered and notify you when your surgery is scheduled. Our CRM portal is currently only set up to receive and return records requests from requesters. As Link users, you have full access to your patient's records already with Link. Let's take a glance at the Patient List activity. The Patient List will provide providers and members of their staff a full list of patients that have your office and providers listed as their PCP or have your office on their care team. It will also provide information about patients you have that are admitted and what their current status and diagnoses are. In Referral Search, you can track referrals you have made into our system, see what their current status is, and close the loop on any outstanding referrals. The Schedule tab will bring up a quick list of all appointments your patients will have within the next 30 days by default. You can also view your surgery schedule for the day here. Next up is the Reporting tab. Reporting allows access to Slicer-Dicer and dashboards, incredibly powerful data analytic tools which you can use to track patient trends, evaluate population health data, and get broader data on things like how many patients are missing flu shots or no-show trends on labs and imaging. Finally, the Patient tab. The Patient tab will act as a way to search for patients that should be on your patient list but are not, either due to not having your office added to the care team, notifying us of a PCP change, or due to an emergency need for access to the patient's records. Note that to find a patient via Link, you must have at least the name, legal sex, and DOB to get a match. The Patient tab also switches to the name of the patient when you have opened a patient's record. In the Patient tab, you will initially open into the patient snapshot. This provides a quick overview of the patient, the current problem list, medications, and immunizations. To dive deeper into the patient's chart, you can use the Chart Review button to find full lists of encounters, notes, labs, and imaging that has been done, as well as additional information in their chart. Under the Care Everywhere button, you will find data shared from other Epic hospital systems that the patient has agreed to connect with. Results Review allows you to review lab results and examine and compare trends. Flowsheets will allow you to do the same with a huge array of other patient data. Under Allergies, Problem List, and Medications, you can view, add, or review data. Note that this will be sent to our staff to match up with the data we currently have available. While there is an immense number of other options, the final thing of note is that under the three-dot menu, you will find Order Entry and Order Review. Order Entry will allow you to order labs and imaging for your patients directly into our system. No more calling in, printing a paper copy for the patient, or faxing orders over. Orders entered via Link are instantly in our system. Orders are pre-filled to make it simple and easy, as well containing the questions in the order to help determine patient sedation needs, exam reason, and if results should be immediately released to the patient or not. Once an order is entered, Providers can sign their order, or clinical staff can pen them to the provider to be signed at the provider's convenience. Thank you for watching this tutorial, and we hope that link will make you and your practice's lives just a little bit easier.